Good afternoon. Thank you for joining us for our announcement webinar this afternoon. My name is Rachel Leventhal-Weiner, and I'm our Chief Research and Planning Officer. And we're joined today by Commissioner Bye, who will offer an address to everyone here in attendance. We very much appreciate your engagement with us today. We will, as in other webinars, offer an opportunity for you to pose questions using the questions pane in the GoToWebinar technology. And if we don't respond to questions, we'll be sure to follow up with them after the webinar. And with that, Commissioner Bye.
Hi, everybody. I'm Beth Bye. I'm the Commissioner of the Office of Early Childhood. Thank you for joining us today. Thank you for your service to children and families, many of you for decades. Really appreciate you being here today. We're looking forward to your questions and your feedback. These are certainly challenging times for children and families, as many of you know, as you've been engaging with them. And we know it's a really challenging time for the programs that serve them. The state-funded early childhood system is a critical part of our childcare infrastructure in Connecticut. And today we want to share plans with you about how we plan to fund school readiness and CDC programs during July and August. During this pandemic, things have been changing, and we did our best to stabilize CDCs and school readiness programs from really mid-March through the end of June. And now we hope to continue to support programs in ways that they can support children and families at this really challenging times. We have worked to build in flexibility because we think that's key. And also all of us need to work together to understand what the needs of children and families are at this time. Connecticut's not alone in not having a full understanding of what the demand is going to be for childcare, but we do know there is demand. We know the demand is growing, and I had a conversation with Governor Lamont today, and he's really keyed into these issues. He understands a critical role that childcare plays in our economy, and he wanted me to send his best wishes to you all. Okay, Teal is going to move the PowerPoint for me. What I'm going to do is walk through with you the plan and a little bit of background to start, but I'll go through that quickly. These are our ethos at OEC for children and families. I'm not going to read through them, but really our big goal is safe, high quality programming, and we want to be responsive to our customers, children and families and programs. And we want to have two-way communication, and that's how it's today is planned, to give you a chance to ask questions too. As I've stated, this is a big challenge, and in Connecticut and nationally, childcare programs that have been very fragile are now on even more uncertain ground. And so working with the state-funded system is one way that we can work together to stabilize the early childhood system in Connecticut. This is what we're looking at right now in Connecticut, and Governor Lamont and I do have conversations every month. We report into the operations center for this emergency and try to make sure we have enough childcare supply. And because demand was so low in Connecticut, we were able to maintain supply. But this is what we were looking at the end of May. So 2 weeks ago, and we have been adding programs. I know some of you have even opened up who are on this call. But this is the childcare supply pre-COVID, and blue is the childcare supply now. Exempt, for those of you that may not know, tend to be school-based programs, which have tended to be closed. And working with Commissioner Cardona, we really have been urging districts, even if their schools aren't open right now, to open for community-based providers that may use their space, or early childhood programs that are ready to reopen, because we believe it's important for young children and it's important for our communities. Okay, Teal. So many of you completed our survey that we sent out. The state-funded programs were the most likely programs to respond. We heard from, you got to go back one, Teal. Thank you. We heard from many of you about what your concerns were, and I thought I'd share these with you. We'll have a final report done by the end of the week that we'll be sharing with the field. But you can see that you had concerns about will families return after COVID. You had serious concerns about lost revenue. and paying your staff and paying your expenses. So, the financing in early childhood is challenged to begin with, and this has added a significant challenge. But thank you for replying to this survey. It really helped us understand what was going on. Next slide, too. Yeah. I'm not going to spend too much time on this because many of you have been on a lot of webinars, but just to say that we've rolled out a series of programs that have both supported early childhood programs and supported those frontline workers with childcare. And these, the last program, the Connecticut Cares for Childcare Business, is the last one we'll be rolling out, which will be within the next week or so, which are grants to private programs and supply grants for all programs. Okay, next slide. So when you take the Connecticut Cares program plus the $78 million that we use to stabilize state-funded programs and to stabilize private programs who relied on Care for Kids and family child care programs that relied on Care for Kids, this is $108 million that's been invested so far that goes through the end of June. And it's been really important, this investment, to support the early childhood system, but a lot of it ends at the end of June, which is why we've been advocating so hard federally with the National Governors Association, with Congress, with national organizations to say childcare really needs some additional funding, and there are several proposals for that, and it's really important. So you can see what it's taken to sort of try to bolster things during this difficult period. So we need significantly more funds to continue that. So today we're going to talk through school readiness and CDC funding, the guiding principle, what programs are eligible, a number of service delivery models, talk about the funding rates, business and community supports, and at the end should be both questions and inputs from providers who are on this call. So first and foremost, school readiness and CDC, we are so lucky as a state. When I talk to other commissioners, they did not have state resources to put out there to stabilize their programs. All they had were the federal resources. And so we feel it's really important to live up to the goals of the school readiness and CDC legislation, much of it that many of you have been advocates for, so that's first and foremost. But we need to increase the supply of high quality childcare right now for our families. Obviously, childcare is education, so we need to also be thinking about how can we meet the educational needs of children, some who maybe can't come to programs right now for family reasons or other reasons. And also have options for programs. You can only take right now 10 children per class instead of 20. There may be some children who can't come every day because of how you're trying to bring children in. So we need to make sure we accommodate that. Flexibility, I mentioned. We're open to input, as I've also said. I think the other piece of these 2 months, because this is 2 months of a year, of a funding year, we need to work together to understand the demand and to thoughtfully plan for children and families going forward in 2020 and 2021. And I'm also really going to look to you all because there'll be some learnings here that we can apply going forward as a state, some things that worked, some things that changed. And I think we all agree we're all looking to improve the overall system in the long run. Okay, Teal. So who's eligible? Who are we talking about when I say state-funded early childhood programs? So the funding for July and August is targeted for school readiness and CDC programs who received state funds in March and who operate on a full year schedule. So because it's a summertime, we do anticipate funding school year programs. It's just that they don't run in July and August. Obviously, maintain the heightened health and safety practices. There's a requirement with our state-funded programs that they be NAEYC accredited or have Head Start approval, or that is in process. We will have to have some different reporting requirements, and we'll seek your feedback, and we'll try to keep those as simple as possible, but this is a totally different structure, and we need to understand what's happening, and we need to, validate that children and families are being served as well. And we're going to ask for your partnership in implementing a family survey so we can plan for the future. So we're going to have two different service delivery models, one being on-site learning and one being distance or hybrid learning. So I'm going to walk you through those and how we plan to fund those. So the first model is on-site learning. And you'll notice some differences in the hours. We're saying a partial day is 4 to 6 hours. It doesn't have to be 6 hours. Full day is 7 to 10 hours. Doesn't have to be 10 hours. Trying to provide some flexibilities based on family wishes and based on you trying to meet the demands of children and families. Services have to be available at least 5 days per week. And you also may provide staggered schedules based on family input. A lot of this flexibility is based on a call we had with 10 or 15 large providers a month or so ago. And we heard about some really creative approaches and to meeting family needs. Some were even open on Saturdays to try to flex the schedule. So we're open to that kind of flexible approach, and we're noting that in both the hours and saying program services available 5 days per week. The enrollment schedule should be based on family needs and also prioritize the care for working families whose household income is at or below 75% of the state median income. So we're asking you to prioritize the spaces for families that need this space the most. So basically, I think conceptually I want to explain this before I just read through the dots. What we're trying to say here is that we know that you can only take 10 children per classroom, and you have a whole system built up and staffing built up for 20 per classroom. Your costs don't go down much at all for having 10 versus 20 children, because you still need an extra staff person, especially with needing to maintain the group of 10 all the time. So you need that extra staff person anyway to mitigate the spread of the disease and keep those children in sort of their bubble. So we're trying to pay you at a rate that recognizes that challenge, so that we're paying by classroom in essence instead of by child, and 10 constitutes a full classroom, and I'll go to the exact dollars pretty soon. So infant and toddler classrooms will be considered a full classroom with 5 children, as long as you have a plan to increase to 8. Preschool and school age will be a full classroom at 7 children with a plan, to increase to 10. And so the funding rates will be based on pre-COVID classroom capacity payments. Now, we know that not all of you operate full classrooms. Some of you may be a program that takes 5 school readiness children out of 100. We also will have a model that allows for individual space funding that will pay when the class sizes are 10 instead of 20, so that's half. That will be paying at a rate that recognizes that. So the individual funding will be double the typical funding as long as the class size remains at 10. And all of this will be adapted as the class size restrictions change. And we anticipate they'll change some, but we don't anticipate it going to 20 anytime really soon. So next slide. The other model that's totally new for us in early childhood, but I've watched some of you, and some of you presented even to my staff, to show us how that can look and what can work about it. We all know it's not ideal. This is a pandemic. We're picking often between something that's not ideal and something that's even less ideal. So I know many of you have been creative here. We know that parents are the most important teachers in their children's lives. And so we want you to engage the family and support the learning and development of 3- and 4-year-olds from priority populations. This funding will be at 65% of the pre-COVID per child rate, understanding that without the facility, there are less expenses for this group. the maximum funding for up to 20 children served by each full-time teacher or 10 children served by a half-time teacher. So this will really depend whether you've assigned a full-time teacher or a half-time teacher. That's how the funding has been developed. And we really ask that you work with your individual families and children. And then the teachers who are providing distance learning should have some experience there, be familiar with technology, and participate in OEC professional development. I'll also say here that we have, along with the governor's office, applied for a grant for distance learning, thanks to my team. And we'll hear in the next couple of weeks if we've got that, but that was a grant for $6 million so that we could both supply tablets for families that may not have access, hotspots for families that may not have access to internet, computers for programs that may not have the appropriate technology, and some platforms. So it's not a done deal, but we have applied for those funds and are hoping to receive some of those from the National Governors Association to support these efforts. And we should hear very soon. Next slide. So the funding allocations are, we know that there will be some, it's going to be different. If you're running a school readiness council, some programs may open and some may not open in July. But programs can apply for funding not to exceed the March 2020 full day and extended day allocations for that community. And we know we need to assign appropriate administrative funds to school readiness councils in order to be able to coordinate these activities. And CDC programs can apply for funding up to their March 2020 allocation. So these are the rates for on-site learning based on what I've told you, based on the class size of 10. Now, it's a little easier to make adjustments when talking about the classroom funding because the classroom funding is just based on paying, you'll have 10 kids and we'll pay the same amount that we paid last year for a full classroom of 20. And so as the program, if say the class size goes to 12 or 13, then we'll pay for a full class based on 12 or 13 proportionally. And we'll be making, so that, because we're just paying for a class, we'll pay for a class based on, and a class will be based on the total permitted per classroom. On the individual child monthly, while it's 10, it's a very easy calculation. You'll be paid at double the per child rate of a year ago, or even of March, to account for the fact that you only get paid, you only can have half as many children. Next slide. The distance learning or hybrid model is $485 per child per month. And then I think you heard me mention that full-time teachers and part-time teachers is sort of how we're basing this. So obviously children are not on the computer all day. It's a appropriate length teaching time and ideas and materials the parents may be able to access at home, and if not, maybe we're happy to listen to ideas for ways to support equipment and materials. As I've said, we're really open to your feedback here. This is not something any of us are that familiar with, but again, some of you have been innovating, and I'm going to make sure that as this moves forward, you can learn from each other. The other thing that's coming in the near future is for those of you who, some of you, as I've said, just have 5 or 6 school readiness children, and state funding is not, the majority of your funding. For private programs who haven't received any of the $78 million of money for stabilization and have not been able to access these rates that I'm talking about today, we're going to have a Kickstart grant for programs that are private programs that get less than 50% of their funding that's going to be a total of $8 million. And then all licensed program, including state-funded program, excuse me. I'm starting to trip over my words, people. Slow down. So all licensed programs can apply for supply subsidies based on the program size. And both the expense kickstart and supply subsidy have a slight rate increase for accredited programs. And then there are a whole host of other items where we think you might need support because of the shutdown. A lot of people are behind in their first aid, CPR, and med admin trainings. We will be paying for those. We'll be subsidizing background checks for new hires and renewals. We did that last year for programs and it was appreciated. We also have built up program quality supports for both accreditation and to support staff family childcare networks. And it's not listed here, but another really important factor here is we're building up statewide capacity to support programs with business supports and technology supports for those business supports. That will be announced in a week or so. So next, I think that's the last slide, but try again, Teal. Oh, well, this is just a quote. First of all, if you've been following the advocacy, you know, the First 5 Years Fund has really been pushing for the $50 billion from the federal government. And sometimes we all know that early childhood education is so important for child development, to support families, really for parent development. You all spend a whole lot of time supporting parents, supporting their children. We know it's good for our society, high quality early childhood education. I think what people have recognized in this pandemic that they didn't recognize before is how important childcare is for our economy and how important it is for our workforce infrastructure. And we're starting to see now and hear from more sectors as childcare is a challenge that they really need help and they really need more childcare spaces opening in order for their businesses to open. At the same time, all of us are tasked with assuring public health as well. So we've been really cautious in our guide and being really clear with programs about best practices. And our early childhood professionals have been doing an incredible job being on the front lines of this public health emergency. So I thank you for your service, and I want to spend time from now forward answering questions for the next 35 minutes. And I'll do my best, and I'll be at a high level, but just know we also have an email there you'll see for questions. You know, we have an application ready to go out to school readiness councils and CDCs, but we didn't want to send that out or have it available till we heard your questions, because you're running the programs. There may be things you tell us that will update our application or make us think of other questions or other ways we can be thinking. So thanks again for your attention, and I'm happy to answer questions.
Hi, Commissioner Bye. I have a few questions. Let's start with, first, we have many comments around sharing a copy of the PowerPoint presentation, and we'll share it afterwards either through the registration list or on our website, and we'll make sure, or through program manager. So we'll make sure to get that to folks after the webinar. Do you want to talk a little bit about you just mentioned the application process. Would you have a question if this is a separate application for July and August? Yeah. And then there'll be another update afterwards?
Yeah, I appreciate that question. Yes, this is going to be a separate application for July and August that you will be filling out for OEC. You know, we don't know what things will look like in September. We would love it if come, you know, August 15th, we send you a contract for September 1st through June 30th, and everything looks the same. Given where things are, we thought we'd do July and August. I was just wanting to do July, and my office was like, no, we've got to do July and August so people have some predictability, and I think that was good advice to me. So the applications are going to be rolling. There's not going to be a deadline. I think we'll learn a lot about supply and demand from these applications. And we'll use the summer enrollment and capacity as a guide as we look to go forward And we'll really also be looking to have a conversation with our LEAs. I do have some concerns. I'm really urging LEAs that might be on the phone to remind superintendents and principals how important early childhood education is. I think with some of the pressure schools are under, I certainly have concerns that they may say, well, we don't have to provide preschool and we need more space. But these early years and the structure and routine for these young children really set their, help their brains develop for the rest of their school career. So I'm just urging those of you who have relationships with superintendents who are under different kinds of pressure, but to remind them how important the early years are.
So we do have a number of questions around when the application will be available, and the answer is soon. So if we don't have a
very
specific,
soon. I think, yeah, we have it. Yeah, we have it. We just, we didn't want to send it out and then have someone on this call make a point that, you know, makes a change that then we have to send out another one. So it will be out very soon in the next 24 hours or so.
Maybe you could speak to, this is a question we received during other webinars, but you had mentioned that you expect the group size to increase, but when could you expect that announcement?
Yes, well, as I've said, we're really balancing public health and program survival here. Public health is sort of forefront of our minds, and the health and safety of children, and really the health and safety of our staff. So there's a team. I'll just tell you how the process works. Last week, I put forward the question in the state process for decision-making with the Department of Public Health. We met with both a workplace safety expert and an epidemiologist. So then you have both someone looking out for the workforce and someone looking at how disease spreads. And they look at things, because I get questions like, well, how come you can have 25 people here and only 10 people here? One of the key factors is it indoor or outdoor? Childcare is indoor, even though we're outdoor as much as we can be. And the second factor is how long are people in a common space indoors? And another factor is how able are they to socially distance within that space? So childcare falls in a very specific place. Kids aren't really good at social distancing. There's not that much space. It's 35 to 70 square feet per child. And they're indoors for more than 15 minutes, certainly. It's, you know, between 7 and 10 hours a day. And so all those things we discuss, they ask those questions. And then this week, there'll be a follow-up meeting with the commissioners of State Department of Ed, OEC, and DECD to go through the request. So the request is, what is a safe class size? And so we have had really good success because of the work of many of you on this call with kids staying healthy and the protocols, because it's the screening plus the mask plus the cleaning plus the small group plus the cohorting, keeping them together. It's important to understand that all these things play a role in keeping the children healthy and safe. And so we anticipate that we'll have an answer this week. I think you could see it go to 12 or 13. I don't anticipate it going to 20 anytime really soon. I think we're all watching what's happening with the reopening of the economy. And I think in childcare, we'll be watching what happens if class size is increased, so that you'd need several weeks at least to a month to understand what the impact of that would be. But it's definitely under consideration for the first time. It really hadn't been under consideration because of, as I talked about, the nature of the care that's happening. I hope that answers your question.
Thank you. We have a question around the definition of a priority population. You had mentioned that you had hoped that programs would be serving priority populations.
Yeah, first of all, we talk about families living below 75% of SMI, kids who might not have access to this kind of high quality program without the work of your programs. I talked to a program who was being really thoughtful about this last week, who because they don't have enough space for everyone, they're starting with their 4s because they're really worried about their 4s having more group experience before they start kindergarten. Now, I'm not telling you that's your decision, but certainly OEC would consider that a priority that would make sense. You may have dual language learners, another example of where the young brain is so primed to learn a second language. And over time, the openness and the capacity, it always stays there, but it's not as keen as when it is when children are young. And then those of you following the news know there's a lot of concerns about children with special needs and their access to programming at this time. So, you know, those are examples of priority populations that I would ask you to consider.
Thank you. We have a number of questions about continuation of other funding sources. So been determined regarding Care for Kids funding and background funding.
Yeah, Care for Kids funding starting July 1st will go back to Care for Kids funding where, you know, programs get paid when they're providing care for children. But Care for Kids is open to families, and I urge you all to encourage your families to apply for Care for Kids. And I'm going to tell you why this is important. First of all, we know there's underutilization of Care for Kids for some of our school readiness and CDC programs. It's a way that you can bring in extra revenue, but it also is something that gives parents something, a voucher that's really important to them. If there was a second wave, that parent that has Care for Kids has the ability to purchase care with a small program, perhaps, or with another provider. So, and the family keeps the funds for 12 months, but it's mostly a way for you to bring in additional funding. So that program is open and accepting applications, and we've also changed the program so parents don't get bumped off at 50% of SMI. They can stay on until 65% of 65% of SMI starting this year. We also have really significantly increased the reimbursement rate for infants and toddlers, who we know that's a group where there's just not enough childcare. And when you look at the graph I show you and add that before COVID, we were short 50,000 spaces for infants and toddlers in Connecticut whose parents needed to work. You can see why that's such a big problem.
All right, thank you. We have some questions about some health and safety challenges during reopening. One specific question around clearance and understanding whether their center is safe to reopen. We've heard from a number of programs who have installed half walls or other ways to kind of keep groups apart from one another. Do they speak with their local Department of Health, or do they speak with licensing?
Any program right now with more than 50 children that plans to open with more than 50 children needs approval from the Office of Early Childhood, who will look at the plans and assure that there's sort of separate rooms and distance between groups. Under 30, you don't need special, under 50, I'm sorry, you don't need special approval. Sorry, we just changed that from 30 to 50. In terms of local health, anytime you do construction in your program, you should check in with local health to make sure it's best practices of what you've done.
So you mentioned, there's a question, you already mentioned the kind of work that you're hoping programs can do with LEAs around the importance of early education programs. Is the agency, or can you describe anything that the agency is doing to work with the State Department of Education around just reopening programs?
Oh yeah, Commissioner Cardona and I have been working closely together. As an example, he authored a letter to all superintendents asking them to please open their schools to community-based providers for summer programming. And he and I met with the governor to talk about this. The governor's willing to do an executive order if needed, because he believes that having these spaces open is so important for our families who need to go back to work. But we're hopeful that schools will cooperate. In addition, Commissioner Cardone and I are part of a committee on Reopen Connecticut that meets a couple times a week. We're also collaborating so that our guidance matches up. It's not perfect, but it's close. So he's part of the group of commissioners that meets weekly for any changes in guidance to try to maintain sort of common factors. Like one factor that's not the same right now is masks, the wearing of masks by children. Governor Lamont has a specific executive order that says the wearing of masks is not required of children in childcare. But I believe public schools are looking at all students wearing masks, which could mean young children. So, you know, there are a couple of differences and we're working to sort of work those out.
I don't know if you'll be able to, we do have one question that's asked explicitly, but it's probably on a lot of people's minds if you have any insight into what the fall will look like. And I think the answer is no, but I think it's important for you to say that directly.
We don't know. I mean, it's so interesting. Like, I don't think we could have imagined the numbers in Connecticut would be where they are today, 3 weeks ago, 4 weeks ago. 4 weeks ago, I certainly wasn't thinking of asking for larger class sizes, but the numbers are down. The incidence of COVID in the average population seems to be much lower. We know we haven't had a lot of cases in childcare. I wish I had a specific number to give you, but it's not something that DPH tracks yet, but they are now. We've worked that out, that they will be tracking that. And we're also waiting for the results of a study by Yale that should give us some good information about incidence. So we just don't know. I mean, things change a tremendous amount in 3 weeks, and we don't know what the impact of reopening will be, reopening the economy and having more people out. I will say I'm so happy to live in Connecticut because my experience has been that people have been very good about wearing masks, about social distancing. It's been an incredible work together across the state to get to where we are right now in Connecticut. And when you compare it to other states, we're doing incredibly well. So I'm grateful to live here. Let's just hope we can keep it up through the reopen. And the Commissioner of Public Health urged all of us on a statewide call last week to keep with our cautious approach because in other states where they have not been as cautious, the outcomes have not been so great on the reopening. And one thing we know is important for childcare is that parents have confidence that it's someplace that's safe for their children. And so we want to be cautious in our approach and have parents hear all the steps we're taking to keep their children safe and healthy. And we don't want to have outbreaks in childcare. So we are being cautious and putting public health first.
So to that end, we have a number of questions around whether our agency will continue with PPE and supplying or distribution of cleaning supplies and other things. We have questions related to reopening or just maintaining supplies so that they can have high standards of cleanliness within their centers and programs.
Yeah, I appreciate that question. That sounds like it's from someone who's been taking advantage. We have 7 sites across the state that have had cleaning supply, hand sanitizer, soap for programs, and we're grateful to the nonprofits that have helped us to have those distribution centers open. The idea of the supply grants is to shift some of this back to programs to purchase, but there were some really good suggestions on the ECE webinar this morning around bulk purchasing that we're going to investigate. And I think that we still have like some really difficult to get items at our 7 sites. So we're focused more now on the masks and gloves. We have some of those at our distribution centers, but soap and hand sanitizer are easier to get. I know people are having a really difficult time finding the wipes. So we are open to input on those things. You can, send notes to the email that's on this page, but just know that we understand that there are more costs related, and we know that the Emergency Operations Center isn't going to be able to keep supplying these, so it's important that we move to having programs purchase it. And so that's why both the Kickstart grant and the supply grant will send, in a couple $1,000s for regular size programs to help them purchase some of these materials. And again, hoping to set up a process where these funds, we can get them out to programs if we're able to get additional federal funds to keep supporting these challenges.
We have a few questions from folks who are wondering about the impact of some programs related to COVID. So the first is, for any parents who are receiving COVID hazard pay, how does that impact their income and their income eligibility for some of our programs?
I am not sure how to answer that question. I mean, if it's temporary incomes, programs should consider that. But I'm going to ask my team to take that question and do a complete answer, because I know for example, the answer for Care for Kids would be based on federal guidelines that we may not have control over. But wherever we can, we're trying to recognize that there are some unusual things going on in both directions. Like, for example, we were able to extend Care for Kids for parents who were laid off, where in the past that parent would have been dropped off of Care for Kids. So we're trying to get federal waivers to understand family situations, and we're trying to listen to you all to understand program situations as you're working to support parents. So we'll get an answer to you on that. Right, team? Right, OEC team?
I think they are muted, but I think that yes. That is a yes.
Yes.
The other question related to the COVID situation explicitly, if a program is open and needs to close because of a COVID positive case, like close temporarily, how will that impact their funding?
That's a great question. We have not, I will tell you, we haven't had that many cases. And of the 3 or 4 cases that I was involved with, talking with the program director, because they were so good at keeping that cohort, it generally, the most it did was close a classroom for 14 days. But each case is so different. I couldn't begin to tell you each scenario, but I can tell you that the OEC will not punish your payment, because if you have to close a classroom, you will not lose funding. If you have to close a classroom because your Department of Public Health tells you, because you have a case, you have to close that classroom for 2 weeks.
Great, thank you. We have a couple explicit questions around some of the things that we covered in our PowerPoint. Can you explain and maybe clarify the individual space funding?
Yeah, sure. I used to run a program like this, so I think it's best if I give an example. So the way we developed the model was we wanted to move to paying by classroom instead of by child. And in fact, this is something we're thinking about systemically anyway, because one child in and out can totally change a program's month and their fiscal stability. So if we pay for a classroom, then we're paying for the classroom to be open for children and families and tracking its use, but paying for that to be open. So the model is we're paying for the classroom what we would pay for the classroom if there were 20 children in there, even though there can only be 10. So at a per child rate, it's double the rate, because we're paying as if there were 20 children in there for 10. But the program I ran had 2 or 3 school readiness children in 3 different classes. So it didn't have a class, it had individual children. To the extent that that's below 7 children, rather than be paid by classroom, you'll be paid for individual children. Or say you're opening up one classroom and the demand is you have 7 kids, 8 kids, 9 kids, 10 kids, we'll pay for one classroom. But say the next week or the next month, you just have 13 kids. So we'll pay for one classroom plus 3 children at double the individual child rate. Harriet, did I explain that properly? You add anything to that, or is that okay?
No, I think that was exactly how it's described in the slide as well. And you know, we're willing to like talk through if people just want to give us a couple of examples and we can help work it through. But it is a mathematical formula that we used, to be honest, especially for the slot based in the classroom. It really was mathematical based on school readiness.
Yeah, and as I said in the PowerPoint, on the individual child level, if the classroom size moved to 13, it wouldn't quite be double. It would be recognizing that now you can have 13 in a classroom. So it will be slightly prorated. But I will also say that, and I think the slide said this, the idea is that whatever it is, July 1st is how we'll base our funding for July. So programs have predictability, and whatever the class size is August 1st, it will be based on the class size for the month of August. A little bit different from the current funding is right now, the way it's structured is per child. If the child's there one day, a program gets paid for the whole month. This will be more prorated by the number of weeks per month per child or the number of weeks per classroom. So I wanted to also clarify that in case that was a question out there.
We did actually have a few questions about prorating times. That was helpful. The team has recommended that we might want to review the funding slide again in the presentation to help sort through some of the questions you were just trying to answer.
So Taylor, if you just go back to that slide. We're getting there. I see the cursor. Now you got me. It's coming.
While we're waiting, there's a couple we have around will there be an attendance requirement each month? So I don't know if we're ready yet to speak to reporting, but that's probably an important thing to address.
We will be asking for attendance for sure, because that's, we said like a lot of this for July and August is trying to understand supply and demand at this time. And we think these months will help us understand that. Why don't you go to another question?
Okay, so we did have a question around the 7 sites for distribution of supplies. If we have that available to share, it sounds like that won't be something that continues for the duration of the year, but do we have a listing that we can share with folks?
What happens is programs as they open, and Deb Fliss maybe can say how often, but when we get supplies, we notified licensed programs through email that supplies are available and where they're available in their region. And that's part of how we sort of can give them out in an organized way versus just anyone that shows up gets supplies. Deb, do you want to add anything to that?
Just that we have been communicating with the list of open providers about every 2 weeks or so. So that they're reminded of the locations, and we try to give a little input about what is available. As you said, we're moving toward masks and gloves, though there are still some of the other supplies at the locations, including that we had a surprise shipment of Dial hand soap recently. So some things are unexpected at the locations as well. And then we've given out information, and there's information on our website on the FAQs about where else to access the kinds of supplies that people are wanting to purchase and that they can use their supply funding for. And that's found on the FAQ section of our website.
I should also say, as Deb's mentioning that, so the Department of Administrative Services has come up with suppliers in the state who have supplies, who aren't gouging, and who are good to deal with, in essence, because there's been a lot of price gouging going on. So we've done everything we can to try to access supplies We know that's been a big challenge for providers. And I don't know if, I think I said on the last call this morning that I talked to one provider whose son is mailing her the cleaning wipes from another state and paying, $20 some to ship them. So she's paying an extra $20 for every 3 or 4 boxes of wipes. So we know it's not easy. And as more programs open, there'll be more demand on those supplies. So we'll do our best to keep you in the loop about what's available.
Sorry, I'm muted. So I think in answering a question here, we can actually preview of an upcoming webinar that we have planned. So we have a question about sort of the difference between what is allowable and what is best practice. If you could let groups share bathrooms, should you let them? Or having groups of a certain size, but less than 50, should they? So I know that we have some plans to really talk through with some programs upcoming, and maybe this is a good time to actually talk through that tension that we know providers are experiencing.
Sure. First of all, let me say thanks to the providers, probably many on the call, who said, you have a lot of memos, but could you put it all in one place and make it easy for us to understand? We have published one guidebook for you to use. And I think it's also useful to share with parents. If I was reopening, I would say, parents, here's what we're doing. It's beautifully done. And I think has some very clear explanation about things like masks, how you can socially distance in a preschool classroom. Even if it's not all the time, here's some strategies like you're not going to have a water table right now that's shared. The kids will probably have dish bins. Things like that are in that document. So that's first of all. Secondly, we're putting together a webinar. I can ask Deb Fliss because I think she's working on this. And we're really working with some of the Project 26 programs and other programs who've been open to say, here are the strategies we've used and be available to answer questions. Because we know a lot of you on the phone are just reopening. I think these are very anxious times. Staff are concerned, programs are concerned, parents are concerned. And so the more we can share clear guidance and be clear about best practices for public health, I think that's great. Deb, can you talk about that webinar?
Sure. The webinar will be a walk through the guidance featuring providers who have been open and implementing practices that have helped them stay safe and healthy. We will deliver the webinar for the first time next week. The announcement about this will go out very soon. And then 2 more times following that, and we'll spread those out just a little bit so that folks have an opportunity to get access to it, and that we do it at different days and different times so that it's easy for people to find a time that will meet their needs. Each of the providers is a different type of setting, different size setting, and has different experiences to share. And so they will share a bit about their experiences incorporating new routines into existing routines to make things run smoothly, to streamline what they're doing, and to make sure that they're in compliance with both requirements and guidance.
Thanks, Deb. Just to get a little off topic, because I'm a toddler teacher, so I'm allowed to do this. This book came last week in the mail here. I don't know how many of you have seen it, but there's some incredible, just incredible activities and thinking. And I also am thinking of some of you that may be doing some distance learning for the first time. I think there's some resources in here that will help you think about that too, helping parents think about their children's thinking and inquiry and how to work with children's questions to build their young minds and to build their thinking skills. So I'm sorry, that was a little bit off track, but I've just been loving looking at that book. So next up.
I'm sorry, I pasted 2 links in in the chat. The first is a link to the guidance you just described, and the second is a link to our COVID-19 response page. We had a number of folks ask for the slides for this webinar, but also ask how they can find out information about webinars and communication from the agency, it's important to make sure that your program manager and your licensing specialists have the most up-to-date communication for your program or center. We find that sometimes when you may have filled out your original documentation, perhaps that email is no longer active or you've changed it. So just make sure that your up-to-date information is on file with with your licensing specialist. But we've also offered you a link for the guidance for childcare in the chat. Right now we're close to the end of our time together, and so I think it would be helpful, I think, to end with some thoughts on the application process and when folks can, what folks should do if they have very specific questions about their program, because we do have a number of very specific programs about health and safety. And I think it would be useful to know who they should direct those, because we cannot answer all of the questions during our webinar, and everyone should know that we have compiled these and we'll reach out if you have something specific we want to offer. But where can folks go if they have something very specific related to their own program or center, or if they have specific application questions?
Yeah, well, I'm really grateful to our early childhood team. I think they're ready to take your questions. They've been working so hard on this and thinking about what is something we can offer these programs where they know they're going to be able to get a fair amount of funding to continue despite the public health guidance. And they have applications ready, they have reporting forms ready. And I also know, and just know that some of your communities may have unique situations. We are open to that. I started this webinar by saying we want to be flexible to serve children and families in the best possible way. And so we are also open to, that there may be individual differences by community. One of the strengths of certainly of school readiness is it's got individual community input, understanding that our towns and cities are so different. And CDCs are in all different kinds of communities as well. So the best thing to do is you can send an email to the email that was up, and you can also call our early childhood team. I know it's Cheryl for school readiness. I know for CDC, it can be Harriet, or you can just email me at beth.bye@ct.gov, and I can get you a phone number. If there's a specific question you have, I can route that for you as well. But I just want to take a moment as I close to thank my early childhood team and say to those of you listening on the phone is they have heard you, they have heard from you. They know the challenges that you're facing in terms of staying open. Our whole agency has, but they've really been trying to think outside the box, and some of their best ideas came from you and listening to how you're innovating to support children and families at this time. So I think I'll just close by saying thank you. We've done our best to answer your questions. We know there are more to come. We'll work with you to improve this program and make it the best it can possibly be for July and August. And the children and families are counting on you. And we know you're all having to dig deep to plan to provide high quality services. And we're really grateful for your service at this time. Thank you so much.